Evaluating the content validity of the pelvic pain psychological screening questionnaire in people with persistent pelvic pain, a mixed methods cross-sectional study. This video is presented by Karis 7. Persistent pelvic pain affects 25% of females and 6% of males worldwide, and it's associated with negative cognitive, behavioural, sexual, and emotional consequences. And for this reason, the pelvic pain psychological screening questionnaire, or the 3PSQ, was developed in 2019, and it screens for the 11 psychological factors that are listed here. The aim of this study was to assess the 3PSQ's content validity from the perspective of people with persistent pelvic pain in 3 domains: relevance, comprehensiveness, and comprehensibility. We used a mixed methods cross-sectional study design utilising an online Qualtrics survey. So within the survey, the participants were first completed the original 3PSQ, and then they were asked if the introduction, the response options, and each individual item in the 3PSQ was relevant to their thoughts and feelings when they were in pain, and also if it was easily understood. And this was in the form of a yes/no answer. If they answered no to either the relevance or comprehensibility, a free text box was provided to allow them an opportunity to suggest how they would change the item to better understand it or to make it more relevant to them. Finally, the participants were also asked if the 3PSQ as a whole captured all of their thoughts and feelings when they're in pain and how they coped with the pain, again with a free text box if they answered no. Primary quantitative data was obtained through the yes responses in the survey, and qualitative data was obtained via the free text responses, and this underwent content analysis to develop common themes or concepts, which were then used to inform and guide discussion of the expert panel, who would use these results to review and make any necessary changes to the 3PSQ. So a total of 146 participants were included in the study, 114 females and 32 males. There was an average duration of 5.26 years of pelvic pain and a pain severity of 5.24 out of 10. If they had a diagnosis for their pain, the most common was endometriosis for females and chronic prostatitis for males. And in terms of mental health diagnoses, anxiety, depression, and post-traumatic stress disorder were the most common for both sexes. In terms of comprehensibility and relevance, over 80% of males and females reported that all 15 items in the 3PSQ were comprehensible. And again, over 80% agreed that 12 of the 15 items were relevant. Both trauma and sexual assertiveness items yielded slightly lower relevance scores in both sexes. In terms of comprehensiveness, it was agreed on by 42% of females and 31% of males, with suicidal ideation being the only missing psychological factor that was identified. Qualitative data identified 4 frequently occurring concepts, the first being misunderstood the purpose of the 3PSQ. So this concept basically summarised the thoughts and feelings of participants who misunderstood the purpose of the survey question, the scope of the 3PSQ, and provided feedback that was irrelevant to the question or voiced concerns regarding other aspects of their pain experience that were not intended to be captured by the 3PSQ. So basically anything that was not related to psychological factors, which is the intent of the 3PSQ. Another concept was specified time frame, where participants suggested that there was a need for a set time frame in which to consider their thoughts and feelings in relation to pain. The third was remove the double negative, where participants suggested that there should be a wording change to eliminate the double negative, and this was specific for statements in items 9 and 15 of the 3PSQ. And finally, specify pain type or source, captured participants' responses querying whether the questionnaire items were in relation to their pelvic pain or other bodily pains, or inclusive of emotional pain as well. The literature provided no predetermined level of agreement to achieve content validity, so an expert panel convened following the data analysis to review both the qualitative and quantitative feedback. And attention was paid particularly to items that yielded lower relevance and comprehensibility scores. The qualitative feedback was used to guide whether these changes should be made to the original questionnaire. and participants commonly suggested that a time frame was to be included. So to achieve this, the 3PSQ was recommended to be split into 3 parts, which you can see on the screen here. Part A screens for general and pain-related psychological factors, B screens for trauma, and C screens for sexual avoidance and sexual assertiveness. This also allowed then a time frame of during the past month to be applied to parts A and C, and during my lifetime to part B. This also meant that all items had to be reworded into the past tense. And finally, double negative statements were reworded for 2 items, so 9 and 15, maintaining the original context of that item. So in summary, the 3PSQ is a validated, concise psychological screening questionnaire applicable to people with persistent pelvic pain. This is a significant achievement and as it aligns with the EAU guidelines for chronic pelvic pain, which strongly recommends the assessment and management of psychological distress in relation to pelvic pain. The 3PSQ may also facilitate health professionals to provide targeted treatment options and thereby improving the health-related quality of life for people with persistent pelvic pain. And we hope you'll read the full version of this article. Thank you.